Welcome to this special Women Day live session where we will be discussing a crucial yet overlooked topic: impact of diabetes on women's overall health and oral health. To help us dive deeper, we have a highly accomplished expert with us here today, Dr. Preeti. Thank you, Dr. Preeti, for joining us. It's a pleasure
Pleasure.
to have you, and thank you so much for spending this time with us. I'm just going to quickly introduce you. So, Dr. Preeti is a consultant diabetologist with 22 years of experience, founder and consultant at Sanghavi's Diabetes Clinic in Ghatkopar, consultant diabetologist at Nahar Medical Center, Chandivali, honorary diabetologist at Ghatkopar Brahman Samaj Medical Center, and ex-consultant at the Third Eye Super Specialities Juvenile Diabetes Foundation, Apollo Clinic, and Nagar Samaj Sanchalit Hospital. So her special interest is type 2 diabetes, type 1 diabetes, gestational diabetes, secondary diabetes, obesity, and metabolic disorders. So for some of you who are wondering what is type 1, type 2, we will be throwing some light on all the terminologies that we've just spoken about. Apart from that, her academic certifications include acute risks of diabetes mellitus from Royal College of United Kingdom, evolution in insulin therapy, current perspectives on treatment design from Joslin Diabetes Center, Boston, USA, contemporary management of obesity from American Academy of Continuing Medical Association, advanced certificate course in diabetology from Cleveland Clinic in United Kingdom, real-time CGM and insulin pump therapy. Wow, that's it's a lot of academic certifications, which is
You
so
can
nice.
cut it short, no problem.
And managing hypertension in primary care, BMJ learning, postgraduate diploma in diabetes management from Middlesex University, London, UK. So thank you so much for doing this, Dr. Preeti. Just going to put my phone on.
My pleasure.
Yes. So having said that, we'll just dive deep into our session of this Q&A. So since it is Women's Day and we will be focusing on how diabetes affects women primarily, so the pressing question is, how does it differently affect men and how does it differently affect women?
First of all, let me wish Happy Women's Day to every wonderful woman out there. Yeah, so diabetes per se, there is no gender difference as such, but then we women are a little bit different, and hence the biology is different, and hence there are subtle differences as far as the male and the female diabetes is concerned.
Okay.
Females, we are protected by our hormones till we attain menopause, but if you are a diabetic, then that protection is gone. So the risk of cardiovascular disease in females is 4 times higher as compared to males, where it is 2 times higher if you are a diabetic. Not only that, if a person already has an heart attack, then the complications in the females are much more higher, which means the fatality is much more as compared to the men. Besides that, the kidney disease, blindness, as well as depression is found more in females as compared to the men.
Okay. And then if this is how women are differently affected, do they also show some different signs, or are there any ways to detect that these are the early signs seen in women or in men? Is it different or it's the same?
It's more or less the same, but what happens in females is most often it's ignored. So, a female having a fatigue, loss of weight, and usually people tend to overlook. So that is what is very predominant in females. Not that the males are not, not showing that, but, it's often ignored more in females. Females don't take care of themselves as well. They don't take their health for, as a concern as compared to the other family members. So that's how it is different, but more or less, otherwise, the signs and symptoms would be same. However, having said that, the chances of UTI or a GTI or a genitourinary tract infection is far more commoner in diabetic females as compared to males.
Okay.
The chance of infertility, PCOD being one of the complications, or maybe a precursor to a diabetes. So those are predominantly female characteristics, but otherwise, more or less, the symptoms are same.
Okay. So since you mentioned about these hormonal changes that happen in PCOS, so how does diabetes impact pregnancy or hormonal changes, like you mentioned about PCOS. So, how does diabetes affect in those women, especially?
So there's something known as gestational diabetes, which is very much on the rise nowadays. So it's basically a diabetes happening only during pregnancy. Once the delivery takes place, the person comes back to a normal glucose levels. So that is primarily because of insulin resistance. So pregnancy itself is an insulin resistant state. If a person already has a PCOD, that's already a highly insulin resistant state. So it multiplies the problems then. So that is why the hormonal changes that takes place during pregnancy happens, and which is why there is unmasking of the underlying diabetes that is there. So it's all the more important that a person becoming pregnant should be screened for diabetes as soon as she finds out that she's pregnant.
Okay. And is there then any other way apart from, the blood test? Do any signs and symptoms show? Because sometimes unplanned pregnancies, till sometimes, even I have patients till their first trimester, they are unaware because PCOS is so high that they are not expecting their normal cycle any which ways for a couple of months, but they've not realized that they are pregnant.
So it's primarily like any other diabetes. So once a person has highly uncontrolled sugars, there is increased thirst, increased urination. There's a lot of fatigue. A lot of people have muscle cramps, especially in the nocturnal period. Unexplained loss of weight, feeling more depressed, recurrent UTI or recurrent infection, recurrent boils which are not healing. And so all then maybe blurring of vision sometimes. So all these are the usual signs and symptoms. I would just add a little bit more. A lot of people don't even have symptoms, so which is why diabetes is really tricky. So the only gold standard or the definite way of actually knowing that a person is diabetic or a non-diabetic is to get themselves tested. It's a very simple test, very cheap to do. It's accessible even in the rural areas. Only
Right.
thing, it should be a little bit of awareness that a person should be aware that one has to be screened for the blood sugars. Yeah.
Right. And many a times, in fact, apart from all these symptoms, I have also seen gum diseases that happen. So even after a cleaning is done, the person has come either with bad breath or bleeding gums or just, accumulation of plaque. And we've cleaned it. And within 3 months, we've seen that, accumulation of plaque has happened again. And the brushing methods have also been good, so that also is kind of an alarming sign. So many patients who come to me, and if I've seen their oral cavity is not good and they're complaining of either plaque accumulation or bad breath, nowadays, even when people are in their 20s and 30s, I'm like, first we need to get a blood sugar and one HB1AC done.
So very rightly said. So, no, I have been practicing since 22 years now. The day I started my practice, I used to get people over the age of 50, 55 coming to me more. And, someone like a 25-year-old, 30-year-old, we never used to even suspect that person would be having diabetes. That were very rare cases. But
Right.
in the past, especially past 5, 6 years, we have seen a really big rise in the younger population becoming diabetic. And as you rightly said, again the oral health that deteriorates, and like any other infection, even a gingivitis or any gum infection, but basically uncontrolled sugars is immunocompromised state. So wherein the infection will not let the sugars come under control, and vice versa. So if the sugars are uncontrolled, the infection will not get controlled. So you have to treat both the things simultaneously. Make sure that the
Correct.
sugars are really well controlled, and at the same time treat the infection well.
Right. So, does gestational diabetes also increase the risk to the developing baby, or do they develop risks after pregnancy? Because, like you mentioned, sometimes it just goes away automatically, and in some cases, it may stay. So, what are the risks that are involved to the baby and to the mother herself?
So the risk is both to the mother and the baby, more so to the baby, because the internal milieu is usually uncontrolled sugars. So that passes on to the baby and it affects the baby. So there might be chances of congenital anomalies. There might be
Okay.
chances of a big baby. The chances of the person going into cesarean section will be more higher because of the big size of the baby. And so all this will happen only if the sugars are really uncontrolled, pre-gestational as well as the gestational period. And there is
Okay.
an internal milieu. Not only that, there's a gene transfer. So it's not only just about the that particular period. It's a intergenerational thing then. So we say that the pathology or the pathophysiology of diabetes starts in utero. So it's very
Okay.
important for a pregnant mother to see to it that the sugars are really well controlled. In fact, a little bit more control in the general population is what we aim for. So,
Right,
for
right.
example, yeah, so for example, if we ask the normal people, a non-pregnant person, to have a fasting blood sugar of around 110, probably in a diabetic pregnancy, we want it around 95, the pre-meals. Post-meals, we want it below 120. A1C, we want somewhere strictly below 6.5, possible at around 6. So then we ensure that the baby is safe, the mother is safe, and probably the future is also safe.
Okay. So, about this is like a good amount of information about gestational diabetes. But what about people who are nearing either menopause or women who are in their puberty? Because I think type 1 diabetes usually starts in children. So, how do children either manage themselves, and what are the risks that are involved in juvenile diabetes?
Okay, so let me first clarify to everyone that there are primarily two types of diabetes. One is known as type 1 diabetes and type 2 diabetes. The difference between the both is the insulin secretion. So in type 1 diabetes, there is absolute deficiency of insulin, and which is why these people will depend on insulin lifelong for their survival and for better management of glucose control. Whereas type 2, there are two defects. There is partial insulin deficiency, which progresses over a period of time. So the pancreas is secreting insulin, but not in enough quantities. And there is a predominant insulin resistance, which means that insulin is secreted, but it is defective. It is not, the body is not able to utilize the insulin, and which is why the sugars remain uncontrolled. So both of them are dangerous if uncontrolled, but both are okay if the sugars remain controlled. So type 1 diabetes is primarily nobody's fault, probably. It's just an autoimmune disorder. Usually, you can't really know the cause. There are some various hypotheses why a person can become type 2 diabetic, type 1 diabetic, which might be viral infection or something wrong with the pancreas, and which is why people develop it. Usually occurring in younger age group children. Although nowadays we are seeing type 2 diabetes even in younger children, as young as 10 and 12 years because of obesity. But
Right.
they have to be dependent on insulin and make sure that the monitoring is done well, the diet and exercise is taken care of well, and insulin is the only answer till now.
Okay. And what about women who are approaching menopause? So a lot of women, I think, previous generations, they've maintained a good lifestyle. They've done a lot of exercise, as in, they've kind of worked in the house and their body has been active. But as soon as, their menopause hits, then they start developing diabetes. At least I've seen in my mom's generation.
Yes. So again, I think what is more important is, so this is something which is natural, which nobody is able to escape, right? So there are a lot of hormonal changes that takes place after menopause. So as I mentioned before, also the protection of the hormones is lost. So then
Correct.
the chance of these persons developing a cardiovascular disease is far more higher, almost equivalent to the men then, or maybe even higher. So it's important that you maintain a certain lifestyle, see to it that the diet is right. By right diet, I don't mean only stopping certain foods, but also including certain foods which are really necessary.
Correct.
Making sure that you take whole grains, maybe fruits, a good protein-rich diet, a little bit of less carbs. And as you rightly said, our ancestors and our parents usually had a really physically active lifestyle compared to what we have now. We do work a lot, but it's more of a mental thing rather than a physical thing. So
Right.
it's really important that you maintain a physical activity, at least 40-45 minutes of a brisk physical activity each single day. Don't think that we are aging and hence we are not able to do it. The more you will be able to do it, the more younger you'll remain, and so then you can keep all the chronic conditions at bay. Yeah.
Perfect, perfect. And apart from that, I think lately, since you mentioned you are getting patients from 20 and 30 age group. So since you mentioned that, we have more of a mental exertion than a physical exertion, and that is causing a lot of stress. And how big is, stress playing a role in this? It actually can take a whole day to answer this. I know
Yes,
it's
yes.
like,
I know it's a huge topic in itself. But to cut the long story short, stress does play an important role. So, like how we have insulin in our body, insulin is primarily a hormone, a protein, which controls the blood sugar levels. Similarly, there are some hormones known as counter-regulatory hormones. In a common terms, we call it as stress hormones. Now,
yes,
that gets activated in times of stress. So whether it's a mental stress or physical or whatever, and those counter-regulatory hormones raises the blood sugars.
Right.
Stress does play a very important role, and it's often ignored. In India, the life of a doctor is also very difficult. We see a lot of patients each day, so it's difficult to actually spend too much time with all the patients. But it's a really very very important aspect, and which is why the social structure of the family also and the friends around is also very important. It's necessary to understand the female undergoing all the stress. Take care of her mental health as well, so that the other
Correct.
things also gets taken care of.
Yes, and personally, having visited you for my dad's concern, and I saw the way you kind of counseled him. So I think that is a very important thing for a doctor to give that much time to counsel the opposite person, because it's so easy to just read the report and write the medication, but if you've not understood what is causing that, because you asked him all the right questions and then you kind of guided him that what needs to be managed in his lifestyle and in his diet to kind of repair, at least manage it better. So
So what happens usually with us also, sometimes we tend to ignore what the patient is undergoing. We see just the reports and we just see the target blood sugar levels. That is not how it should be done ideally. We need to
correct,
understand why the patient is not able to follow. What are the inhibitory things that he is not able to do it, or what stops him from doing it. There's a lot of guilt, there's a lot of depression, there's a lot of anxiety, there's a lot of anger because of these diseases. It's a chronic condition, remember, it's a lifelong condition. Having to take multiple pills every single day,
correct.
taking care of the diet every single day, always thinking while eating whether that is right or wrong.
Yeah,
So
it's
it's very easy for the person on the other side of the table to actually tell them, but to do it is a very different thing. So one
correct.
has to involve the patient, and it's a shared decision, clinical decision.
Right.
So once you involve the patient, once you understand them, probably they'll also understand why it should be done.
Correct. So if you had to kind of sum it up for women, what are the lifestyle changes or modifications that a woman in the age group of 20 to 40 and then 40, because 20 to 40 is a different kind of challenges, different, age group dealing with different things, and 40 to 60 may also be a different challenge and dealing with different things. So is it same or is it different for, the women in different age group?
So it's slightly different. I think there are a lot of, apart from the medical things that we speak about, there are a lot of psychosocial factors and the socio-economic factors also in
Correct.
taking care of a person's health. And we women are really different and special because our body and our mental and physical, everything goes on changing with age. So
Correct.
with those changes, we need to keep up our, we should be also changing in our lifestyle. Primarily, it's again a healthy food diet. Being consistent, I think, is the most important thing.
Correct.
And there will be ups and downs in life. I've seen a lot of people giving up on their health simply because something else has happened in the family or otherwise.
Correct.
So that is one factor. And I don't know, but we females tend to be very emotional about it and tend to feel guilty about taking care of ourselves. We are
Right.
always not never on the priority. So there are five people ahead of us, and by the time you take care of them, probably you are lost somewhere. So I think that needs to change. A female should understand that taking care of one's health also is equally important. So if you want to take care of the whole family, it's important that you are taking care of yourself first. It's
Yes.
like, traveling by airplane and something happens, you need to put the
First
oxygen
put
mask first.
the
Yeah. So that attitude needs to change. Fortunately, I've seen nowadays, today's young women are better off in taking care of themselves a little bit. There are a lot of stress factors as far as the age group is concerned. So in the 20s and 40s, I think there are a lot of eating outside food habits that is happening. Okay. And there are a lot of stress because of the career thing and everything, and people, entering into the marriage and all those things. So that is another again phase of life where it's a very stressful situation for them, and which is why it
correct.
is impacting their health. No time to exercise or maybe no intent to exercise. So that is another one thing. Between 40 to 50, again, because of the hormonal changes, then that takes place. And maybe people are used to living a certain type of life at that point of time.
Correct.
So that is where I think as females, we need to change. Rest all, so everybody knows. Yeah.
Okay. Okay. And so now, like, I'm just going to direct it. How does it affect oral health? So from a diabetologist point of view, how does diabetes affect oral health?
I think the oral cavity is the gateway to everything. So you may be more better suited to tell than me, but I think it starts everything here. And if your person is immunocompromised, the chances of the oral ulcers are more. The
Correct.
chances of oral thrush are more. So even because of the highly sugar environment, probably there are a lot of dental caries that happen.
Correct.
So yeah. So I think all these needs to be taken care of. I think we are too much into retinopathy, nephropathy, and all those things. But
As a
we also
complication.
as a complication, but we never talk about oral health as such. You being a dentist, probably you'll be able to throw more light. But I think it's important, and a lot of times we have seen, only when the toothache is really bad and they're not able to, then the person realizes that, you need to control the sugars. At the same
Correct.
time, important because of the pain. So till the person doesn't have symptoms, probably it's often overlooked. And I think it's important to visit the dentist on a regular basis for that. Yeah.
Right, right. Does it also affect the sleep quality in individuals? I mean, it's about women, but then it in general, does it affect the sleep quality? Is it related to sleep apnea as well?
Oh, right. Okay. So this again something that I can talk for 2 hours. But so sleep apnea is another very, very common thing. And this is not typically related only to diabetes, but lot of other conditions, especially the cardiovascular health and otherwise. Now that primarily the soil for all this theory is obesity and insulin
Yeah,
resistance.
true, true.
So you'll find sleep apnea, you'll find hypertension, you'll find diabetes, you'll find cardiovascular disease. All these people are usually obese and insulin resistant. So they have what
Hmm.
is known as the visceral fat, which is more, the fat in the organs. And this is what is giving rise to all the chronic conditions. So
Correct.
sleep somehow is disturbed because of the sleep apnea in many people. Primarily when the sugars are very high also, they have the symptoms of frequent urination, and which is why even though they are feeling asleep, but they can't because of the frequent urination that they have. So that
Yes.
is one thing. A lot of people with uncontrolled diabetes have nocturnal leg cramps, which makes them a little bit, the sleep is disturbed.
Correct.
And a lot of people, again, depression is also one of the things. So all things combined, the sleep quality does get disturbed. And vice versa, in the younger generation, people who work in the BPOs, people who do night shifts, the sleeps are disturbed, and this sleep pattern in turn give rise to diabetes. So it's a two-way thing.
Correct. 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 And just like lastly, to kind of sum it up, so are there any new advancements in diabetes oral care or in diabetes management? And then we'll talk about the oral care.
I'll leave the oral care thing to you. I'll need to learn it from you. But a lot of new things in diabetes management. And so earlier days when we used to treat people, it was only from the glycemic point of view. That is, we knew only how to control the sugars by giving certain drugs and some advices. The reason for that was that we only had those kind of drugs.
Okay.
Nowadays, there are a lot of new drugs, the newer ones. We now don't think only about the glycemic control. We also think whether it helps in the weight reduction. We also think whether it helps in the reducing the complications. So it's like a far more wider approach to how we look at the patients now. We also think about saving the pancreas from getting the insulin secretion decreased over a period of time. We also think about the patient not having a hypoglycemia despite a very good sugar control. So all this can be
Correct.
drug with a done with the newer drugs that are available. So fortunately, we are in an era where the monitoring systems have improved in terms of not only the glucometers and the A1Cs, but we now have sensor devices where you can just put a sensor and it will monitor the sugars every 15 minutes. So that also gives the variability of the glycemic control. So all these things are available. It's important that the person should know and should do it. Utilize it well, utilize it early in life so that you don't have complications later on.
Okay. And speaking about the complications and the latest advancements, in fact, sometimes I have also seen that, only if the person, especially women who are suffering from PCOS, they are put on, insulin either in tablet form or in some form or the other to prevent diabetes. So is that a good practice to do when,
It is a,
somebody comes to you?
so
Not maybe to you, but in general to a doctor saying, okay, I have PCOS diagnosed, but is PCOS care, does that include the substitution of insulin, medication?
So for that, you need to understand what primarily the pathophysiology of diabetes is. So
Okay.
primarily in PCOS as well as in diabetes, the pathophysiology is insulin resistance.
Hmm.
So it's a defective insulin, which is why PCOS happens, which is why also diabetes happens, and which is
Okay.
why it's correct in treating the lady with the PCOS with a drug known as metformin. So it's a very good insulin sensitizing drug, and that needs to be given. Don't avoid therapy. I don't know why, but a lot of people are very hesitant to take medicines. मेरा शुगर अच्छा है तो आप क्यों दे रहे हो? मेरा तो सिर्फ बॉर्डर लाइन है तो आप क्यों दे रहे हो?
I was
So
the same.
people, yeah, so we all, as humans, we don't like to this, but sometimes one need to understand it's not a choice,
Yeah.
it's not an option, because if you don't do it now, probably at a
We'll-
later stage, you'll have to take more medicines with more complications. So
Correct.
in India, what one thing needs to change, according to me, is the mindset of, the fear of taking medicines should should not be so much as the fear of the disease itself. It's vice versa at the moment. So we are
Correct.
not fearing the
That's
disease.
true.
ठीक है, मैं कर लूंगा, we'll see at a later stage. But we don't we I have seen number of people even at 300 and 400 sugars not asking me too many questions about the sugar itself or the disease itself, but
But
probably
the
of the
medicine.
medicines and the side effects. So don't count the number of medicines. I'm sure all your doctors are good enough to take care of that. And in diabetes, we cannot over give the medicines. Otherwise, you'll fall into low sugars. So that
Yes.
is not going to happen. And if at all that happens, consult the doctor, take the advice accordingly, and change the dosage. So never fear taking medicines, fear the disease itself.
Yes, that's a very nice line. Fear the disease and don't fear the medicines. So, is there any way to understand the pathophysiology of, how interlinked is this? Is there a test or something that is available to know whether the PCOS woman has the pathophysiology because of this insulin resistance, which may cause the diabetes as well?
So PCOS is a very, very different topic altogether, but
Right.
there are certain set criteria by which we diagnose PCOS. First is the clinical features. Another is some hormonal test that we do, and a
Okay.
sonography. So
Okay.
the combined, so there is a set criteria, and if the person fits into that criteria, we
Then you
label
have
that this
to
person is
manage
having a
it with
problem, and
metformin.
then accordingly manage. But again, just one more addition to what I said earlier. So apart from the metformin that we give, the primary thing that really works in PCOS well is losing weight.
Right.
That helps in diabetes also. That helps in insulin resistance also. So again, I would say the foundation therapy for any chronic disease, particularly diabetes and obesity. Nowadays we call it as term as a diabesity. So it's so interlinked that we
Correct.
term as diabesity, and to reduce weight by whatever means you can. So it could be diet, it could be exercise. Ideally, it should be both and on a consistent basis, because number of times we have seen that people do attempt, they do lose weight, but the consistency is not maintained, which is why the disease is back. So if a person loses good amount of weight, by good amount of weight, I mean even a 5 to 10% of a body weight loss will
Correct.
really translate you from being a diseased person to a healthy person. So that
Absolutely.
is worthwhile doing it and do it consistently.
Super. So I think we've covered all our questions, which I had in mind to ask, and which would also help because this recording and everything will be also shared. So I'm just going to add an aspect of how a dentist sees diabetes. So whenever we have patients who have come repeatedly with gum issues, especially, so that's the first red flag that tells me that this is diabetes. And how we help in managing diabetes is, apart from taking care of the gum disease with medication, we also do a cleaning, removing of the plaque. And something that has kind of changed our practice for diabetes patients especially is using lasers. So like how sunlight has this particular frequency, UV rays is harmful, and which kills the bacteria as well. And there are some good frequencies of light from the sun that help us in formation of vitamin D. It helps the plants grow. So similarly, laser has those frequencies that helps the individual and the cells to kind of overcome this infection. So number one is the bactericidal effect. of laser, and the second is the photobiomodulatory effect. So when photobiomodulation and the bactericidal effect of lasers is combined in diabetes patients, we have seen that the accumulation of plaque is also lesser. In many studies that I have gone through, it is also said when poor oral health is there and there is a lot of formation of plaque and tartar, that could also give rise to increased insulin or blood sugar levels, sorry, increased blood sugar levels. So now there are, ways to kind of not only recognize, because internally what is going on is going to be difficult, but a dentist, when you open your mouth and you kind of see the oral health condition, and if I have told the patient that I think your blood sugars are high, I don't think so, and probably they have not even tested it, and then they'll come back with the test with the HV1AC above 8, and they said they don't even know. So that is one aspect, like how a dentist can contribute in helping the diabetic population of the country. And apart from that, आ गया है अगर अभी, तो उसको मैनेज करने के लिए भी lasers are really helpful. Regular cleanings and keeping your oral hygiene great is also something that I have seen, that management of the diabetes complication that at least happens in the oral cavity is much, much, much better.
Okay, thank you so much, Dr. Darshita. You have
Yes.
opened my eyes also to a certain extent. And from henceforth, I promise that I'll not ignore the oral health also of my patients. Few
Thank
quick
you.
questions from my end also to you.
Yes.
So how many visits do you recommend for a person who doesn't have any issues otherwise, so-called no issues? How frequently do you actually advise people to go to a dentist for either a cleanup or a regular checkup?
So ideally, we say once in a year is good enough. But having said that, if there are some issues like either it's gum disease or it's cavities, then after we've completed the treatment and we've made your mouth clean, cavity free, then once in 6 months, at least for the first 2 years, to see that how the maintenance is happening. And we also advise a lot of oral hygiene methods to be done at home to keep the mouth clean. जो स्टेट पे हमने लाया है, we've removed all the gum disease pathogens, we've removed the cavities and everything, and that has really helped me change my practice, because now the patients are like, not only is this doctor giving us the treatment, but also advising us how to manage it better. Also, another part I have seen is a lot of patients who have diabetes, and if they have to undergo a tooth extraction or dental implants or any surgical process, so whenever there are uncontrolled blood sugar levels, it is always advised not to do. So when with the help of a diabetologist, when we get that under control, also lasers help a lot in the healing, because whenever any surgical procedure, or even if it's a slight cut, in diabetes patients, the healing is something which is affected the most. And that we have seen in our practice, that lasers has really helped even in surgical cases where I've had their blood sugar at maybe 300, but the patient is in so much pain. So we have done the extractions and we've sutured it and we've given laser religiously for 3 days, and there has been zero post-op complication. And we were also surprised, because even we fear that what if the patient has not maintained all the post-op instructions, and because if they've maintained also but the blood sugar level is fluctuating so much that the healing doesn't happen. But in that case, lasers has helped us. So I think for all the viewers, if you go to the dentist for any oral related issues, and if you're a diabetic patient, make sure the dental practice is equipped with lasers, because lasers has really changed the way we manage diabetic patients and the oral care of diabetic patients.
Great.
Yes.
Thank you so much for the enlightening me. Yeah. Thank you.
Yes. And thank you so much, Dr. Preeti, for removing time and educating our viewers, and especially on Women's Day. I couldn't have found anyone better than you. In fact, when I met you for the first time, in my mind, I said, this is one of the very few doctors that I have personally seen who spent so much time on counseling, rather than, just seeing the blood report and then writing the medication and then, asking the patient कि ये ले लो 3 महीने के बाद मिलेंगे. Because so many
Because
doctors I have interacted with have genuinely, just seen the blood report, given medication and asked, but the way you counseled it really made a difference in my dad's life. So thank you so much for,
thank you for the
being the
appreciation,
nice.
but I must tell you one thing. I'm really impressed by how a dentist takes a diabetes so seriously. And I have found very few dentists who have great insight into diabetes management as well. So thank you for asking all the right questions and educating every one of us. Thank you so much.
Thank you, Dr. Preeti. Thank you so much.